Good morning, everybody. Good morning. I want to welcome everybody to the Appropriations Committee Health Subcommittee presentations, and I want to thank everybody for coming. My co-chair is watching, but we are making her stay at home. So I'm sure she will pipe in because she can do that on Zoom, so that's okay. But we want her to rest so that tomorrow I can stay home and she can do it. No. But we've had a long 2 weeks and it's been a lot of late hours, so I definitely understand that. I want to thank everybody for coming. Are there any, let's see, Senator Berthel?
Good morning, Madam Chair. I apologize. I'm having trouble with my camera, so I can't quite seem to get it to turn on. But no, I'm here, and they have been long weeks, but productive, and a lot of listening and things that we need to obviously consider and figure out as we move through this very quickly moving session. So here we go, another fun week of listening and trying to understand. Thank you, Madam Chair.
Thank you. Thank you, everybody. So we will start out with the first committee, Department of Developmental Services. Commissioner Shep. Good morning, sir. I want to make sure that everybody understands that even though we have a lot of members are on Zoom, and they will try and participate as much as possible. But I also want to let everybody know that we start our public hearing today at 2 o'clock. And at present time, we have 263 people who are going to be testifying today. So that means that we will probably be here very late as long as we move it right along. And remember, everybody, this is a time for the public to talk to us. So that's why we have the public hearings like that. So thank you very much. And thank you all for your support and indulgence. Thank you. Go right ahead, sir.
Good morning. I'm Jordan Sheff, the Commissioner for the Department of Developmental Services, and I thank you for the opportunity to be here before you today to testify on behalf of the governor's budget. I'm certain that you'll have a lot of questions. In the spirit of your quick-moving session, I will refrain from reading my written statement that's been put before you, but I do ask that you review it. In particular, there's a graphic in there that I think important to all of you based on our work together last year around the wait list. So I do hope that you will look at that. I'm joined today by a number of staff, including our CFO, Nick Gerard, to my right, here to help assist me answer any questions pertaining to the budget. And with that, Chair Walker, I turn the microphone back to you.
Thank you, sir, and thank you for brevity. First, I want to ask before I get to my members, are you lapsing any funds in any of your accounts?
The answer to that question is yes. I believe it already came before a committee here with reference to $7 million that we're lapsing this year.
Do you can you tell us in what areas?
I think Nick can help me with that in particular.
And who are you, young man?
Hi, I'm Nicholas Gerard, DDS CFO.
Thank you. Go right ahead.
So we're lapsing that funding in both the residential and day account.
Residential and I'm sorry, what
and day. Employment and day services. I apologize.
Oh, and day. Okay, day services. Okay. The day services account pays for what exactly, sir?
Day services pays for employment services, alternative day programs, individualized day, in whatever way individuals we support define a meaningful day. We use that funding to support it.
Okay. Well, I'll stick with the two questions. I'll be back because I want to ask about that. So,
yes,
are there questions from the committee? Representative Dillon?
Good morning, Commissioner. As you might expect, there's a lot of concern in the public about some of the lapses here. And I did remind people that you had actually protested many times that you were concerned that we might not have the capacity to do everything that we were asking you to do. And so I have no interest in trying to embarrass you or complain complaining, that's part of our job. But but I am concerned about let's say if we're talking about certain categories, we have testimony before us today from a provider in the greater New Haven area that I've worked with for many years, that they had to close one of their homes because of lack of staff, I think. And I don't know that we can do all of it right here, and it may be more appropriate in a work session, but we did have a very ambitious initiative last year. But we keep hearing about staff shortages, and obviously where I live, a provider had to close a home, right? Despite the fact that we put all this money in. I wonder if you could unpack some of that. And are you familiar with the provider that closed the home?
I'm not certain. I likely am, but I don't know that I could call it by name. I will tell you that the COVID was certainly the biggest challenge of my career in providing supports and services. But it has been piggybacked by a workforce crisis. People in the industry, and I've been in the industry 35 years, have talked about workforce issues all of that time. You here in the legislature have heard from providers about the challenges they've faced historically over that same period of time about being able to hire and retain staff. But we have never seen a workforce crisis or the impact of a workforce crisis like we have experienced since the end of the pandemic. And I do think that the types of issues that you just described, closing of homes, relating to the lapse, that the workforce crisis is the biggest issue, biggest challenge we face. And we are working hard to partnering with providers to try and remedy that.
Well, as you might expect, in our position, we answer directly to the public. So given the magnitude of the investment, naturally people are concerned in the area that happened and why whatever we were doing didn't work. And I wonder, if not right now, because I obviously with all the high interest in this topic today, if everyone shares the time, we have a 13.5-hour hearing ahead of us starting at 2. So that's if everyone shares the time. But I wonder if you or maybe your friends at OPM, we could unpack what this workforce crisis means, because it's taking on this kind of totemic value that it's like we used supply chain for a few years and nobody ever unpacked it, and I just want to make sure we understand as a committee what the workforce issue is about, and if there's something concrete and measurable we can do this year to fix that.
Thank you very much. I've partnered with OPM and the governor's office to bring on a staff whose full-time job is dedicated to unpacking, digging into, and resolving the workforce crisis. Mary Pat DiCarlo, and I'll ask her to join us at the working meeting later this week so she can speak directly about her work and where we hope it's heading.
That would be helpful, and obviously we want to help people, and there's a tremendous amount of need. So anything that any concrete, measurable steps we can take that are feasible would be helpful.
Thank you. Next, Senator Marks.
I'm good, thanks.
Oh, okay. Okay, all right. Representative Gilchrist.
Thank you, Madam Chair. Good to see you, Commissioner. I want to continue on this conversation about the workforce crisis and focus on what I believe is a $7 million cut or lapse that reflects savings due to lower utilization. And the write-up talks about wage enhancements. And so I'm concerned, I'm confused, because it's my understanding that those wage enhancements are meant to address the workforce shortage. We're hearing folks aren't being paid enough. And so if we could increase wages, then we'd be able to get more workers into these vital services. So what is the process? Because to me also, when I'm out there in the community, I just can't believe that there's low utilization, right? Like folks are just saying they need these services desperately. So is it like a chicken and the egg? Can you only give the funds based on the client count? And then if that's the case, we would continue to have this issue, right? Because we need to be able to get those funds to these providers so they can increase wages, get more staff, and then be able to bring more clients. So how does this play out?
Pardon me, my mic was off. It's less a chicken and an egg issue than it is, well, I suppose it is. The wage appropriation that the monies that are part of the lapse would be targeted directly to employees, is how we have done that historically. So if providers don't have the employees, then there's no place to put the money. And because the utilization is low, they have, it exacerbates that issue. But we are talking with OPM about what that may look like going forward. Our calculations that led to the appropriation we received were based on utilization that we had hoped to return to, utilization that was in the rate of utilization prior to the pandemic. We have not returned to that rate of utilization. And so in that way, it's the chicken and the egg. If providers had more staff, we might be closer to that utilization rate. And without that utilization rate being up, we can't put that money into staff's pockets. So it's a little bit of that. And we can dig in a little deeper to that impact on Friday when we get together again.
That'd be great. And I'd love us to be a part of that process and what that language could potentially look like to maybe get those funds to these providers, to set them up to hire. Maybe there's like a 6-month, I don't know what it would look like, but how could we do that?
And I want you to know that we have made multiple types of payments to providers to assist with the workforce crisis already in this year. And even with that, we'll still lapse the $7 million.
Okay. Thank you. That's all for now. Thank you.
Thank you. Are there any other questions? Wow, that was easy. So I can go back to mine. So on the employment and day services program, did we have a waiting list at one point for them? And I believe it was 2 years ago. So now we have a lapse. So I'm concerned why we're going through that right now.
So when we typically have talked about wait list, historically, we have talked about the residential wait list. We do track a number of people who are not yet receiving services, but it's not an issue of funding in terms of us being able to allocate funding for their supports like it has traditionally been on the residential side. So were providers to have all the staffing they need, no one would necessarily be waiting for day services. But as you talk to your constituents, you're hearing that people are waiting for access to day programs, but it isn't a lack of our ability to fund them. It's a combination of the providers not having the staff to be able to bring in additional people, and where that is where any sort of day wait list that we have stems from. Not a lack of funding in that SID for day programs, but a lack of collectively of being able to have enough staff and enough providers to provide everyone who wants an opportunity to have one.
And I think that just continues with what my colleagues were sort of talking about is the workforce and how do we expand it enough to meet the needs of the people that we serve. So that does pose a major problem. In your budget also are 22 people that are being slated to move from your agency into the technology optimization, as they call it. Can you tell me what services or how is technology embedded in your agency? What does it do within your agency?
Well, we use technology in a variety of ways, and in the way that the state IT services have run, it is how we procure information systems. It's how we track data. It's how we communicate with one another, both through virtual means as well as email. We use a lot of IT in a lot of different ways throughout our agency at all levels of the organization.
Do you also do case management and things with your clients and do you have a case management system also in your IT?
We are in the process of procuring a new case management system through the ARPA funds. It was one of the items that the legislature graciously approved when we applied for the intent to use those ARPA funds. And so we're in that procurement process. What we use now for case management is 4 or 5 different types of systems, including just using software like Word. Our case managers cobble together from our targeted case management, from our camera system, from our authorization system, from a variety of different systems. They create a case document and have a case record, but we do not currently have a single piece of software that I would refer to as our case management software. But that's what we're looking to obtain.
But you have not procured it.
Not yet. We're on a rapid trajectory to do so, and I hope that we are in the implementation stages sooner rather than later.
Do you still have ARPA money left in your fund to continue the procurement, or is that-
Yes. So there's 2 streams of ARPA money. There's the ARPA money that we have used for certain things, and then there's ARPA money related to the HCBS waivers that we earned on the back of the pandemic for our good work then. And this is, I believe, from the HCBS waiver money, and that is still allocated and will be encumbered before its expiration.
I'm sorry, HCBS alphabet.
Yeah, I'm sorry. Home and community-based services through the federal government.
Mhm. Okay. So that leads me to the next question I have on your ARPA funds. Do you have ARPA funds that you have not completely exhausted yet or utilized in projects going forward?
I'm going to ask Nick if you're prepared to.
He started
talk a little
shaking
bit.
his head, so it was
Yeah,
like that was his cue.
Good. Thank you.
Okay.
Yep. So I'm going to go through the different categories of ARPA funding. So we have a community engagement project where we still have 1.1 million of a total of $2 million. And we're looking to issue that money to 2 additional providers.
Wait, community engagement, can you give me just a little elaboration? What does that mean?
So community engagement would be ways that DDS individuals can interact or connect with the resources in their community and finding providers to make those connections.
Okay, and you've used 1.2 of that already?
We've used 800,000, so we
800.
have about 1.2 remaining.
Great. Okay, go ahead. Nice.
We have a one-time stabilization grant of $20 million. We've received all the requests from providers. The requests far exceed the $20 million. So we're working on a methodology to distribute the $20 million. We plan to have the $20 million distributed this fiscal year.
So that's for stabilization. Okay, wait. We use a lot of buzz terms and I get a lot of texts from people, so we're not going to do buzz terms today. So we'll try. When you say stabilization, could you give me a little bit more elaboration on that, please?
Sure. So the providers had losses, both actual losses and lost revenue during the pandemic,
Mhm.
and this money is to help fill in those gaps.
Operational,
Correct.
staff-wise?
It could be losses from what they had to pay to staff. They may have had to pay staff extra in order to, provide the services throughout the pandemic.
No, I mean, that's good. Okay, go ahead.
We also have 1.5 million left out of 3 million for respite care. DDS shares that money with other agencies. So this year we transferred funding to the Department of Social Services. I believe they're using that for autism respite. We also are trying to open up a new children's respite center.
Where's the Children's Respite Center going to be?
I do not know the physical location.
The current 7-day-a-week Children's Respite Center is operated in Enfield.
Enfield, okay. All right, we have is that an area where we did not have a vendor before?
We have a number of vendors providers that operate in that area, but the home that we could get to be made available was in Enfield. I actually visited with the Lieutenant Governor. It's a lovely home. And we're excited that it exists because we hadn't had dedicated children's respite previously. And that's operated by Edelbrook, I believe.
And that's for the statewide, correct?
We utilize that statewide. Our original hope was to have something more central, but the building was available there. So as we proceed and we demonstrate success there, it would not surprise me that we have an additional children's respite center in future years.
Because my co-chair is under the weather, she can't ask the question, what about the eastern part of the state? So I just want to make sure okay. Thank you.
Thank you for asking on her behalf. I do
listened
miss
to
her
I
being here.
listened. Go right ahead. Go right ahead.
The last one on the list is funding for transportation. And we are looking to hire a DDS staff person to help us procure a future RFP to meet the transportation needs outlined in the ARPA funding, the ARPA request.
And is this for statewide also?
The transportation position would be to help us coordinate and evaluate and assess the needs for transportation statewide.
Okay. Okay. And I'm sorry, the amount that you had.
750,000.
750.
That wouldn't all be for one staff representative.
I was going to ask that next, but I'm glad you covered that.
The expectation would be that we'd hire and embed a staff with the department, but that there are companies out there that do this routinely as part of their operation, and we would look at potentially procuring a subcontract to help us with that analysis and taking a look, and then collaborate with our partners at Department of Transportation and the non-emergent transportation program run by DSS.
Okay, because we are struggling right now with our rates for transportation. I think if you watched any of our hearings, we had a number of people here that were saying that our rates were extremely low. So we have to make sure that we provide people with the adequate funding for those.
And if I can, Rep. Walker, before you move on, and I apologize, you had asked, and I was anticipating a follow-up that I didn't get, so I want to take the opportunity with regards to the IT optimization, consolidation, whatever word that we use optimization, and I know that
That's been the buzzword.
okay. I want you to be very clear. I shared some of the concerns I've heard representatives articulate prior to the optimization, and I dragged my feet in being very deliberate in working through the memorandum of understanding to ensure that we would be protected from the kind of things that you and your colleagues have suggested might be concerns. And it has exceeded my expectations in terms of how it's worked. The same staff that were available to me prior to the MOA are still available to me. I am still able to set the priorities for the agency and direct some of the resources, even though they're paid through that MOA or MOU by DAS. So while I understand the concerns, I wanted to let you know it's working really well.
Thank you, Commissioner, and thank you for being a good soldier. But I think we all have a bit of a concern, just because we are spending a lot of time and effort and money to try and give you the independence so that you can serve your clients. And when you have to go to another agency to say, "Mother, may I," it really diminishes the opportunity. So that's what we do, and you're doing your job. So thank you very much for that. Okay. Senator Marks.
Thank
Oh,
you,
you see,
Chair.
you got more. They picked up now.
Yeah,
Go right ahead.
Thank you. I had to sit down and just take a few breaths. Thank you, Commissioner, for being here. So, one of the reasons I became a senator was the wait list with as a visiting nurse, seeing what happens to the families as the parents age and having their children stay with them into their late 20s and 30s. And I always use the analogy, I had 4 kids, and the anxiety I would have if I was a little late for work or the grocery line was a little too long. And I had a child that was young, and I had to meet that school bus. And that anxiety that you have, that you're not going to meet that school bus, and every parent knows that anxiety. And then I thought, what would that be like if it was for 30, 35 years? That our parents of special needs children have to have. And so when you say that, like, I just cannot believe that we're taking $4 million out, and then that's $7 million for the underutilization. It's just so hard for me to comprehend that, knowing what the needs in our community are. So my question is can you get us the wage scale for what we pay the people, the caregivers that take care of those in group homes and those where the $7 million, like they probably aren't getting jobs because good paying jobs. Is there any way of getting those wage scales for some of the different not-for-profits that are using our good taxpayers' money to take care of what our taxpayers' money should be paying for, which is the most needed people in our community.
Thank you, Senator Marks. We can provide some pay analysis that we've collected over the last couple of years as we've worked with providers. The way that the money came to us was directed at raising a minimum wage. So there's a standard minimum wage across all providers, and then there are providers who pay differentials above that, both for existing staff or supervisory staff, and for other reasons. So we can pull together some of that information and provide it to you.
That would be wonderful. I would love to see that because I want them to be good paying jobs. Thank you.
Thank you.
Thank you. And you give that to Madam Administrator so that all of us can get that, correct?
Yes.
All information goes to Susan Keene. If anybody doesn't know that out there in this world, please send it to her so that everybody gets access to the information. Thank you. For the first time, Representative McCarty, and for the second time, Representative Gilchrist.
Thank you very much, Madam Chair, and welcome, Commissioner and your staff, and thank you for the work that you do. I'm not sure if this question had been asked, but if you would just clarify for me a little bit, the intermediary, the new fiscal intermediary contract, how that works, and if you'd just like to elaborate on that a bit for me.
So I'm going to turn to Nick, and if you're not ready and available to do that, Krista's with us, and I know she'd be happy to step up and speak to that.
So I'll start, and if we need to elaborate, we'll call up other staff. So we worked with our sister agency, Department of Social Services, on procuring a new fiscal intermediary. The thought was that with the economies of scale between our agency and their agency, we could find an intermediary that could provide enhanced service along with, at a cheaper price than if we were to procure the fiscal intermediaries on our own. At this point in time, the new fiscal intermediary is planned to start at the end of March. So individuals from both the Department of Social Services and Department of Developmental Services are starting to interact with that new fiscal intermediary. They're reaching out to parents. That fiscal intermediary really is the backbone of our self-direction program and ensures that families, individuals can self-direct their services, have choice, move the money in the way they want to, and hire their own employees. And that fiscal intermediary is a key part of not only making those connections, but also doing all the payroll in those situations.
And you envision that will be helpful for efficiency's sake and for being certain that these individuals are able to do the self-direction better, I guess, yeah.
Yeah, so these are individuals mostly that are already participating in those programs. And when we procured the contract, we made sure that we found a vendor that could be more responsive to individuals and families and parents along that process. So individuals have already been doing that. Part of our goal was to make sure that, when they call this provider, someone actually picks up within a certain amount of time. And that was part of our RFP. So we are looking not only to find some efficiencies across agencies, but ensure that the new fiscal intermediary is more reactive to our parents, individuals, and families.
Thank you very much. And if I may, just a comment, I also agree with Senator Marks, when we see that money is not being utilized, that's been allocated and taken back, when we have such a need for the waiting lists and the services. So anything we can do to be helpful in that regard, would appreciate. Thank you.
Thank you. Representative Gilchrist.
Great, thank you. So my question has to do with the Office of the Child Advocate investigative report on the critical incidents in community living arrangements. Just wondering if you could talk us through any steps you all have taken to address those findings and any fiscal implications that we might want to consider.
I don't envision any fiscal implications at present. The OCA publishes a number of reports, so it would be helpful to know which report in particular you were citing, because they just issued one last week that was much less about us, but there are a couple prior that we were involved in.
This was about the community living arrangements.
So I'm going to do my best. I think I know the one that you're referencing. So prior to Commissioner Durantis's leaving, and for all of her time in that role, DDS has worked very, very closely with DCF to improve our working relationship and to the cooperation, the collaboration. And the new incumbent, Commissioner Hillilly and I have committed to furthering that work. So we meet quite often. As a group, we include the Young Adult Services partners at DEMIS because there's some overlap there as well in our collaboration. What's unclear sometimes for the agencies, and I think for the public, is who has statutory responsibility for children in terms of when they're presenting. Is it their intellectual disability? Is it their mental health? Is there some other need? And so it makes those things complicated. In particular, there are a couple of things that OCA commented on in there and that we are looking to improve. Information sharing, what we can and can't share based on privacy laws that exist in the state between state agencies and how we might share that. How we did separately on our own. DDS has worked very hard and invested over a number of years in a product from a vendor named PulseLight that helps us detect through hospital claims unreported critical incidents. And I think critical incidents and how those are identified and then followed up on was one of the other findings from Sarah and her team in that OCA report. So what I can tell you is there's ongoing work. We look at some of those solutions as being harder to reach because of the nature of the information systems currently in the state. That it's not as simple as it might appear to the public when it comes to some of that information sharing. And then Commissioner Hillilly and I have agreed to continue an escalation process for when there are issues in situations where we share responsibility for support services and the outcomes for those supported. And we think that that will be highly effective. Remembering that the citations from that report were about issues from a number of years ago. I think some of it going back a decade in terms of the potential information sharing, if I'm remembering the right report. Things are much different now than they were then. And I think that we will try and codify some of that working relationship in terms of how we share information to prevent an adverse outcome as was cited in that report, which I think resulted in the death of a child in foster care. But that's why I'm not certain which report you're referring to.
Thank you. And I understand there are a lot of reports. I do believe they'd also discussed the licensing oversight. And so does that still remain? Are you all responsible for the licensing oversight of those types of entities? And if so, do you feel like you have adequate staff?
We have the staff to provide the licensing. When we had a meeting last week about a home in particular, and Commissioner Hillilly and her deputy commissioners and my staff met to discuss just that when we license a home but are not the funder and don't provide oversight, what is our continued role in that situation? And I think that we continue to need to evaluate that and make some improvements. It's difficult for DDS when the only function we provide in that home until the children are 21 or older is licensing the physical plant, and the DCF licensure doesn't deal with some of the things that our licensure were. So in regulation, there are stark differences between the licensing functions at DCF and the licensing functions at DDS. And while both end up with having a licensed provider, they don't necessarily evaluate the same criteria when providing that license. And then the ongoing work looks different for both of those teams. So it's pretty complicated, but we continue to look at it and evaluate it and try on a right now we're working on a case-by-case basis how we'll manage those environments till we can figure out what we might do in terms of a longer-term solution.
Thank you. Representative Dillon.
Thank you. I just want to follow up on Representative Gilchrist's question on your response. And I don't want to draw it out too long, but I hope you bring some of this to the work group. Am I hearing that DCF and DDS measure different things when they have joint responsibility over a facility? And therefore sometimes things fall between the cracks? Is that accurate?
I have to reflect on that statement. I can tell you that our licensing team, when it comes to children's homes, is really primarily looking at the physical plant issues. And that licensing, because that's our obligation in that home, since we are not funding the providers and don't even necessarily have contract with the providers. that may be operating in that home. DCF's role is to make sure, to look at program, the milieu in the home, the types of services being delivered, and then the program outcomes, and they evaluate that process. If it was all in a DDS home, when we do licensing for our adult services, we're responsible for all of those things all in one. And our licensing team has capacity to do that, but we are not experts in the type of children's services that DCF is. So they look at program integrity issues. DCF is looking at those in those combined situations, and not us. And I think that's the struggle that the OCA pointed out and that we are looking to resolve.
Okay, and since it's between two departments, the Office of Policy and Management does develop the budget, but it does have the title Policy and Management, and it does theoretically have some kind of a duty to bring departments together to have a coherent policy. Are they at the table, and have they come up with, are they working with you to
They-
come up with that?
They are working with us. Our budget analysts and Judy Dowd is the section chief for Health and Human Services budgets, has attended a number of those meetings. More recently on the policy end, Claudio, and I'm not going to pronounce his last name, but you know Claudio, thank you. Claudio has been attending as well. And what Commissioner Hilili and I have committed to doing is trying to identify and shine light on those issues so that OPM can be part of solving them with us.
Thank you very much, and we'll probably ask more, but I appreciate it. Thank you.
Thank you. Thank you for your answers. I just sort of wrapping up some of the things that I've heard. Good afternoon, good morning. Just one sec. But I think it would be helpful if we had an opportunity to see the responsibilities that you have over licensing in the facilities, and we will ask the same of DCF, and we'll have a special session just to talk about licensing between the two, so that we can make sure that all the things are covered, and we'll invite OPM too. We'll invite Judy.
I look forward to it.
Okay, thank you. Also, one last one. Last year, we had a bill 5001 that was focused on DDS, and some of my colleagues have sent me texts saying that we'd like to see if there were things that were completed and things that have not been. And if you could bring that to the work session, that would be helpful, because we are over time. But Representative Johnson has her last question.
Thank you so much, Madam Chair, and thank you for being here today. I just wanted to know if we could have more information about the waiting list for the group homes, because this has always been an ongoing issue, and also how the $7 million that you have that was in the implementer last year, how that are you focusing that on trying to address some of the problems that we have with actually funding people who are underpaid, so to speak? And or are we looking at trying to do the licensing, as Representative Walker was saying, because licensing for the group homes, because there is a huge need, and I think it's been ongoing for some time. So I'm just going to reiterate those things, and thank you so much, Madam Chair, for the chance.
Thank you. And Madam, we did talk about it, and we asked them to bring that material to the work group earlier. I think Representative Gilchrist or Senator Marks or somebody, or maybe me, I don't know, but we did ask for that. So we're gonna make sure we do that. So thank you, sir. Thank you for your
Thank you.
testimony, and maybe we'll see you later on. Thank you. Have a great day. Next, we have the Department of Mental Health and Addiction Services.
Good morning, everyone. Good morning, Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio, and all the distinguished members of the Appropriations Committee. I'm Nancy Navarrete. I'm the Commissioner of the Department of Mental Health and Addiction Services, and I have with me Cheryl Aurora, who is my CFO. If you like, I can go through the changes that are in the governor's budget for the
That would be wonderful.
okay, so there are the primary area where there is investment is strategic investment in housing. And that's over 3 different initiatives. The first, and it spans both our private nonprofit system and our state operated system. So the first is housing wraparound services. For over 30 years, we've been working.
Excuse me, just a second. Is that door closed over there? Yeah, okay. Just ask people to move away from the door, please. I'm sorry, Nancy, you're
No problem.
speaking very softly, but that's okay.
Okay,
I just want to make sure everybody can hear you.
sure.
Thank you. Thank you
Thank-
very much. Go ahead.
Thank you. So the first is housing wraparound services. We've been working with DOH for 30 years. This is a very successful program where we we marry the vouchers on the DOH side with support services on the DEMA side to help people who are exiting homelessness stay housed and be successful in their housing placement. This is added $1.3 million for these support services, and it'll match 140 federal housing vouchers that are available through DOH. The second is our homeless outreach team. This project is on the state operated side, so it expands our staffing in the urban hubs to be able to outreach to and engage individuals, keep them safe, connect them to services. And that's $1.2 million. We embed outreach teams in shelters, bus station, parks, soup kitchens, and other areas to get people connected to services. And then the third area, also on the private nonprofit side, is a program called SOAR, SOAR. And you probably know this from your constituents, that it's very difficult to apply for federal benefits for Social Security, disability, and sometimes it takes multiple efforts to be able to bring those entitlements to fruition. So these specially trained case managers help people walk through that process, especially when you don't have access to a safe place to keep your documents. You may not know the exact steps to walk through. And in fact, we can double the rate of people being able to access those federal entitlements by using these specially trained folks to help people that may be homeless. There are also a couple of other adjustments. There's over $1 million in additional funding to support operational costs for serving high-need clients. So the cost of psychotropic medication has increased. And so there are $730,000 to help us pay for that. Also, as we are looking at folks that are in higher levels of care in hospital settings, and we want to discharge them to the community, specialized risk assessments so that they are safe and the community is safe, help us to be able to get the right placement for people. That's $167,000. And then there are certain contractual obligations that we have when assessing people who may qualify for nursing home placement, and that's $163,000. And those are the major investments. There's some back and forth of staff transitioning. There was a misallocation last year to DPH for staff for our Whiting Forensic Hospital staffing requirements. So that comes back to us, for example, as well as the IT staff moving out of the department. So happy to take any questions. Those are the major changes in the midterm budget.
Thank you, Commissioner, and thank you for giving us sort of a brief overview of your budget. I want to first ask, are there any funds that you are lapsing in your account?
Yes. So there are 2 SIDs. One is the Home and Community-Based Services account, and that's $1 million lapse. And then you see that is taken out of our budget. So that tracks on where we have been spending. And then there's $300,000 in the Medicaid adult rehab option account. And that is just a matter of claims. So if there are not enough claims submitted by the providers, then that money won't be completely spent. So those are the 2 areas.
So I know one of the things that I've learned in this position is that Medicaid is always in the rears. So the 300,000 that you're talking about in Medicaid claims, they're when I say in the arrears, it takes 6 months for us to recoup them from the feds. So are these 300,000 that you're talking about, has that already been submitted?
This is more a matter of volume. So
Oh,
sometimes there are services, so an individual has to receive a certain number of hours of services in order to ring that bell for that claim to be valid. And sometimes people are too ill or maybe in the hospital, and therefore the claim is not submitted. Did you want to add?
And the home and community-based services that you talk about, that was also an area that Department of Developmental Services talked about, has funding that they had not utilized too. So I'm
I think-
sensing a theme here that I think maybe OFA will have an input on this, because we'd like to know a little bit more about why we're not utilizing those funds.
I think Commissioner Chef was talking about the ARPA dollars.
Those
through
were,
that-
those were just ARPA dollars?
I believe
Okay.
so. And these dollars it's an ongoing SID for us. And you can see that historically, we are spending about 1 million less. So it made sense that the budget was right-sized to take that million out. That would be on track for what we're spending for the number of people that are coming through the system. So we are able to serve everybody that is looking for services, that need services in the community.
Okay. Um, hmm. I'm going to let my colleagues start with that, and I'm sure they will, because we have such a demand out there for mental health services. And for us to have not extra money, but money that has not been utilized well, I'm going to ask this. Is it because we don't have enough providers or enough staffing in the providers industry that we could not utilize that? Because I'm sure we could find people that could use those dollars.
These are specific services. You may have heard of the mental health waiver.
Yep.
So these are services that money follows the person. So for example, somebody's in a nursing home, they may then go over to the DSS program, money follows the person, and then they're transferred to us under this program. And we provide things like personal assistance, recovery, coaching, helping people develop skills so that they can live on their own and don't have to be at an institutional level of care.
Mm-hmm.
So the flow of referrals has been such that we've been able to serve that demand of people for that particular program. This is not for all mental health services across the state. It's for this group of people that otherwise might be living in a nursing home.
Very prescriptive.
Yes.
Okay. All right. Questions? Representative Dillon, then Senator Marks, then Representative Porter, and Representative McCarty. Did I get everybody? Yeah. All right, go ahead.
Thank you, Madam Chair, and thank you for your testimony, Commissioner. Just to, I guess for the work group, but if you have the top of mind, the 12 positions that are being added, where in the state will they be placed?
At our state operated local mental health authorities, so including New Haven.
Over time, we've had conversations about various teams and whether or not we had adequate coverage in Eastern Connecticut or in Northwestern Connecticut, if I recall. And I wonder if you could look at that and see. I know that even though on paper, I realize that paper is kind of an obsolete word to use, and it appears that sometimes that the resources directed there are adequate, but let's say if you're in Torrington or in Eastern Connecticut, very similar, the transportation issues are quite different. We have transportation issues in the city too, but the distance issues are quite different. And I wonder if you could take a look at that for the work group to make sure that there's adequate coverage everywhere in the state.
Sure. And just going back to the 3 initiatives that were being invested in this year, 2 of the 3 are in the private nonprofit system. So for example, permanent supportive housing, we serve over 4,000 people over the state of Connecticut. So that's all areas. And the same thing with the SOAR investment. That's also in the PMP system as well. And there are other pots of money. We have a PATH grant through SAMHSA. We have HUD dollars that are infused into the community. So just for permanent supportive housing alone, we have 48 providers across the state.
Thank you. I guess I'm mindful that we may have, I don't know whether they're going to pass a budget in Washington. So I want to make sure that we're not too heavily reliant on any one funding source. But the Connecticut Mental Health Center under the previous administration was cut. I believe the West Haven office was closed and the staff there was kind of walked out in front of their patients, and I think 115 people were moved, if you recall.
No, that it's still open. So the West Haven Clinic is still open.
Do you mean the one for kids?
And young adult services, yes.
Right, young adult services, but there was another component there
Mhm.
as
It-
well. No, you're right. There
yes.
is still an office there. I'd walk that back the way I characterized it. There was a building. Some of the services were closed. And I think about 100 people were sent to New Haven and others were sent to Bridges and to maybe the Hill, West Haven, with no new money. And so their caseloads increased. I want to make sure, and because we did look very much at their services to the Spanish-speaking community at Connecticut Mental Health Center, that became really front of mind during the pandemic. There were a lot of families who had public-facing jobs, and there was a lot of illness and so forth. And so that was a good thing. But I do want to look and make sure that after those 115 people were moved out of West Haven into New Haven and Milford, that there's adequate funding at CMHC to cover the caseloads, really. I think it's been hard on some of the workers there, from what I understand.
Yes, we've been able to absorb all those clients, and the Latino Behavioral Health Network is alive and well and doing very well at the Hispanic Clinic, and then across the state with the collaborative of other providers that work with Hispanic Clinic.
And just to add to some of the concerns, I think that Representative Walker was referring to, maybe it only happens if it's a legislative ad, or maybe there's a certain caste system in OPM about whether dollars get out the door, but it does seem over time that sometimes some dollars didn't get out the door, and programs didn't get up, not because of a workforce issue, but because the money just wasn't released. And I am thinking of one, I think, in your agency, although I think the problem is fixed. Is it an issue with DA? Is there an issue with DAS? Do you have enough contracting people to make sure that all of everything that we are working together on gets implemented?
So we have our own contracting unit at DEMIS, and yes, we've been able to get our contracts out the door.
Thank you very much. Thank you, Madam Chair.
Thank you. Senator Marks.
Thank you, Madam Chair. Thank you, Commissioner, for being here. I feel I have a big weight on my shoulders to represent Eastern Connecticut with Senator Austin under the weather, and I am going to try so hard to make her proud. So I have a lot of questions. I have a lot of questions, but I know I'm going to do two. These 12 positions for the outreach team engagement, how many unfilled outreach team engagement worker positions are open presently?
I don't know how many vacancies we have. These, of course, are new. So these are proposed. These are not filled. I don't know how many vacancies across the state we have.
Can you find that out for us?
Sure.
Okay. I have one point like, could this be a part of the first question? I just, so real quickly, and I would like to know the pay scale for what we pay these people working on the homeless outreach. Okay, and then real quickly, so is there homeless shelters, homeless hospitality centers? That's in New London. We have the homeless hospitality center that I am so proud of the work that they do there. But it is a homeless shelter from, I don't know, from New Haven. I'm not sure. There's another one to the west after New London, and then all the way over to the Rhode Island border, and then up past Norwich. I'm guessing Wyndham and Middletown, probably. I don't know how far north. Like, is there any statistics about like how many homeless hospitality centers, that's a nicer word, there are per capita? I just feel like ours in Eastern Connecticut, in New London, the town I live, where I go all the time to take care of clients, I can walk into there and it's Martha, Martha, Martha. I get lots of hugs. They know me as the nurse, not as the senator. And I just feel like we don't have enough resources for our homeless population in Eastern Connecticut with just one shelter. And if we have $1 million here and $1 million there and $1 million there, why aren't we taking all of that money to support another homeless hospitality center somewhere else in Eastern Connecticut? So that's a big question, but is it something that you can help me to try to start to understand?
Sure, we can work with DOH. We are not the primary
Oh, that's
funder of the housing, the shelter
Oh,
system.
I wasted a question. Okay. True. But could you help me to
Sure.
try to start understanding
Yes.
this? Okay, I appreciate that very much.
Thank you, and I'm sure you're going to be back for a second go round. Representative Porter, then Representative McCarty, then Representative Gilchrist.
Thank you, Madam Chair, and thank you, Commissioner, for your presentation this morning. I wanted to ask you about Whiting. You mentioned staffing, and I did miss the numbers on that. Could you just speak to what it is specifically we're
Sure.
talking about in the budget regarding Whiting?
There was legislation last year asking that hospitals that were licensed do additional reporting to DPH, and money for that role was inadvertently put in DPH's budget instead of DEMIS's budget. So it's just moving that back.
Okay, thank you for that clarity.
Yeah.
And then I wanted to touch on, I see cannabis prevention in the budget. Cannabis prevention.
Yes.
And I wanted to ask about that because I see in fiscal year 24, there was 2.1 million. And for fiscal year 25, we have actually added $1 million. So if you could just talk a little bit about what this prevention looks like and why is it costing us an additional $1 million going into fiscal year 25. And after that, because I just want to be done, the working group, I think if you could just take a deeper dive into what you're going to touch on right now, that would be helpful.
Absolutely.
Thank you.
So with the legalization of cannabis, there was money put into our budget for 3 positions to help us expand prevention as well as a media campaign. So we have launched beintheknowct.org. I don't know if you've seen that, but it explains the law. It's very simple, explains the law, addresses anyone who may be at high risk, pregnant women, underage folks, safe talks about safe storage. So very basic, clear prevention messages. So that has been launched and then it'll be fully annualized this coming year. And we'll continue those efforts.
Okay. And what was I think it was a .org you said?
Yep. beintheknowct.org.
Okay. And just for the working group, if you could give a breakdown of,
Sure.
2 million, 3 million for 3 positions and this media campaign you have going on.
Yes.
Thank you. And thank you again, Madam Chair.
Thank you. And yes, for the working group, could we get as Representative Porter pointed out, you had 2.1 million in 24. How you've utilized that, and then what the extra 1 million is going to be for that, and where we are with that. So, next, Representative McCarty.
Thank you very much, Madam Chair, and welcome, Commissioner, and your team. I'm also from Southeastern Connecticut, so we're going to be giving some attention there. I know that I'm very pleased to see the effort to help with the homelessness situation throughout our state. And recently we did the Navigator program that went throughout the state. And it's kind of a comment, but I would hope that the department could work with that group to see what the success has been, and that there could be maybe some coordination with the outreach for the homelessness. I think the mission, there's some similarity there, and rather than duplicating, learn from what has been done and work together on that, if you think that's a possibility.
Yes, thank you for that. Yes, and a lot of times our local mental health authorities, whether they're PMPs or state operated, will help coordinate those efforts in their region. So yes, I agree with you. Whatever we can do to coordinate is helpful.
Thank you, and I'll be back in touch with you on that. So then, could you just comment a little bit? I noticed that we're going from the general fund, taking the opiate settlement funds from the general and moving it over to that board. Could you just assure us, and then maybe bring some information to the work group of what districts have availed themselves to that funding, how it's working, and just your guidance on that?
Sure, I could just give you a high level overview. So Connecticut has reached our saturation benchmarks that we developed with national experts to get naloxone out into the community. So we also were able to avail ourselves of many federal funds, and we just made a bulk purchase actually, and have plenty of naloxone on hand for anyone who wants it at any time. Any part of the state will get that out to people. We do a lot of that work through our BHAOs. I know you're familiar with them. They do some really great work in the community and are available to train people and to distribute naloxone if anyone should need it.
So basically, my question was just with the transfer, I wanted to be assured that everything was still running smoothly and that these funds were available to all those entities that need them right now.
Yes, they are.
Okay.
We have
And
more than enough.
Right. And it is concerning to see the increase that we have with, throughout our state, just also with our students in the behavioral support. So I think it's so important right now that we do all that we can to help, including our seniors. If you could comment, have you seen an increase in needs in our senior population with mental health needs?
Oh, I was just out in the southeastern part of the state at a senior center out there. And yes, I think that as our population ages, that we have to just track on what the needs are of seniors. We do have senior outreach and engagement services available across the state. So if people are unsure or don't know how to get connected to services, we are available to do that. We do things like nursing diversion. As I mentioned earlier, the home and community-based services, most of those services are for older folks. So yes, we do see an increase there, along with the conversation that I'm sure you're hearing Senator Murphy talk about with and Susan Bysowitz talk about loneliness and isolation, and that of course applies to seniors as well.
Right. Okay. Thank you very much for your work.
Yes, thank you.
Thank you. Representative Gilchrist.
Thank you, Madam Chair. Good to see you, Commissioner. I know there's been a lot of questions on that 1.2 million, but just wanted to confirm those are new dollars, or is that a continuation of ARPA dollars that we're funding those 12 positions?
Oh, those are new dollars.
New dollars.
Yes.
Okay, thank you. And then wanted to check in on the CVH STAR program.
Mhm.
Last session, I believe, post-pandemic, there was kind of some merging of the men and women's units. And so just wondering, what's the status of the 30-bed female unit? Is it back up and running? If you could just talk us through that.
Over the next couple of months, we will be at 100%. So I'm excited that we're the last 30 beds. We'll be bringing those online, and then we'll be back to pre-pandemic levels.
Wonderful.
So it's very exciting.
Great. Thank you.
Thank you. Yes, I have a couple more questions. First, I'm going to continue with Representative McCarty's question. Could you just, I'm on the opioid settlement team, but a lot of people don't know where we are because we don't have that information always out. I mean, it's out there, but they don't. Can you just explain where we are with the funding process right now? Just sort of what we did up to November, et cetera, and how we're going forward with that, because I think that a lot of my colleagues would really like to hear that.
Absolutely. So we've been meeting for about a year, a little less than a year now. I am co-chair along with former Mayor O'Leary from Waterbury. And the first agenda item really was to create a structure, because we're starting from scratch. So we need to have bylaws and agreement on how we were going to approve dollars to be spent from this fund. And so that has all been set up. There have been subcommittees that have been formed, have been very active. We had both a environmental scan and a draft of what was called the core report by Yale. So an academic kind of benchmark of what the best practices are for us to be able to give to the members. I believe there are 47 of us, to give to the members to have as a guidepost to say, these are things that are recommended in the field to address opioid remediation. Over the course of the next 18 years, we could potentially get $600 million. Right now, we have about, in terms of what's under the purview of the Opioid Settlement Advisory Committee, about $75 million in the door to work with. We have approved one recommendation that was approved in November. So that is money that will go to DPH, $500,000, to fund additional supplies for syringe exchange programs and harm reduction materials. So that was our kind of beta test, and it went very well, and that money should be getting out there to providers. We had an open portal, so anyone, everyone, any stakeholder could write in suggestions, and you still can, even though that portal is closed. You could always connect with any one of us and make a recommendation. We are now sorting through all those recommendations using the Alcohol and Drug Policy Council, which has been around for many years, contains all of the subject matter experts in this field. They are vetting all those recommendations, and they will bring forward to the Opioid Settlement Advisory Committee those recommendations which are prioritized. Doesn't mean the other ones won't be funded eventually. It's just to get us started and what is going to be the biggest return on investment in terms of lives saved, because our goal here is to prevent people from dying. And we still have, even though we've had a decrease in overdoses over the past 2 years, which is wonderful, we need to bring that down even more. So whatever is going to stop people from dying, those are the interventions that we're going to implement. Anything in prevention, treatment, recovery supports, special population, criminal justice, all of that is allowable expense.
Thank you. And just to continue a little bit, we also requested all the towns that got money from the settlement to report to us on what they're utilizing their money on. So I think all of this helps. Many of the members of appropriations have been concerned about what are we doing with the money, like we did with tobacco fund, which we will have a conversation about also. But it helps us to look at prevention in different ways. And because we are so limited in dollars in some of the areas, it's important that all the legislators know that there are opportunities like this that are out there, and hopefully with looking at the information that we got from the towns, we can also maybe identify where there might be extra need in other areas than in other areas, even though everything in the eastern part of Connecticut needs have more help, right, Senator Marks?
Yes.
Okay, thank you. Thank you. And then my other question is on your IT services. You have, how many people that, I forgot,
45.
45 that are to be transferred over to IT optimization. What types of services or what types of reporting do you use your IT system for? I ask everybody this so that just so that we have an understanding of it. Okay.
As Commissioner Chef said, everything from email to applications to our internal system for collecting data, our external system with our private nonprofit system for collecting data, our secure things like security cameras, everything is digital now. So security cameras, tape, any kind of database. We have a data warehouse. All of that is something that we use. When you ask us for information, we can pull that information. And we have some of those folks who are quality folks that are on the DEMA side. The technical side would be the folks that would work for BITS.
Thank you. Thank you for that. And you do have case managers in your agency, correct?
We do.
And that's also part of the IT system because that's the way they keep their logging in and the services and the backup and everything, correct?
So we are, you probably know, are in the process of procuring for an EHR. We do not have a comprehensive EHR at this.
Everybody's procuring it. So all of a
Yes.
sudden the heavens opened up.
Yes.
Yeah.
But that being said, we do have programs that collect information. We have both paper charts and there are some digital electronic.
Okay, thank you. Representative Dillon.
Thank you. And very quickly, and congratulations or thank you on the way that you managed the family support for the returning military at a time of declining resources. And I wondered because it was clear from the literature and then it became clear from a story that I knew of someone in New Haven that women returning had a very different clinical profile, that they were not just substance abuse issues or a loss of mission, which is very common with the men, but that they were sexual assault survivors and they had a higher rate of suicide. So we added a tiny amount of money, all that we could get, to look at services for women veterans, and there was a tragic story that we don't talk about much in our area that really forced me to have to deal with it in a way that I wonder if you could, is there anything else that we can do? Because I know that I was interested in the women. The military department was concerned about outpatient. We were unable to fund that last year. Do we have the capacity? Do we have, how are they doing? I mean, what is the state of their, I don't know, I don't want to say debility, but are we doing what we plan to do in terms of resilience?
It's been a great program, the Military Support Program, MSP. So there are a couple components to it. There's a centralized call line. So anyone, any military person can call that line, get connected to resources. The folks that run the line have military experience themselves, really do have the cultural experience to be able to guide people in the right direction. We have embedded clinicians, so clinicians that will attend National Guard events. And we also have a network of providers that if people don't want to use their government benefits that are less private and secure, then folks can go through this network. And if they don't have the resources, we will help support them get the therapy that they need. We did hire a female Navy veteran who has been very helpful to the team and has been very sensitive to the women's issues. Oh dear.
I just,
Excuse me, Senator McCrory, would you mute yourself, please?
Absolutely. I am so sorry.
well, that was a surprise. Um, has the hiring of that one clinician met the needs? I know that we have, for example, the Home of the Brave, which, you know, and we've done some things, but I wonder if we could take a look at, and we may have to reconfigure something or at least look at other funding sources. I don't know. And you've been incredibly resourceful at keeping it going when it was at risk, and that's wonderful. But if there's anything else that we can do, it would be helpful. And it would be helpful to know how many families have been served. And if we have any other data on that. We have one report, I think, that was done a while ago.
Sure, we can update those numbers for you.
That's great. Thank you.
Thank you. Senator Representative Johnson, do you have a question? I know, I caught you. Any questions? Because we're getting ready to close down. I just want to make.
Thank you so much for your presentation today. And the only question that I would have is, it was already asked in terms of the follow-up with
Good.
people that have senior citizens being homeless and needing to be able to find a place because they are no longer admitted to nursing facilities like they have been in the past because of certain case law that's come down. And so these are the kinds of things that I'm looking at in the MAPOC committee. And so those would be the kinds of things that I would be asking
Thank you.
but it was already asked.
Yep,
So
good.
thank you, Madam Chair.
Thank you. Representative McCarty.
Thank you, Madam Chair. And very quickly, is there any coordination with the Department of Public Health when you do the nursing home screenings? And how does that work? I noticed in one of the contractual services, you have a fire risk evaluation. Maybe you could just speak to that for
Sure,
one
there are
moment.
two different components.
Yeah.
So the high-risk assessments are for individuals that might be leaving the hospital. And so in order to obtain the best secure placement for the person that's healthiest for that person and also safe for the community, this assessment would help us match that person to the right services. The other is a contractual relationship with DSS, actually, to assess people to see if they meet nursing home level of care.
Okay, and if I'm not mistaken, I believe that there is nursing home screening that takes place in other agencies. So that was just the question, whether there was any coordination there.
Yes, we coordinate across departments, but
Okay.
this is specifically for individuals with mental health and physical health co-occurring issues that might require them to be in the nursing home.
Okay, thank you.
Yes.
Thank you. Senator Marks.
Thank you, Chair. Thank you. Second question, hopefully it's relevant to this committee. So I'm also about the nursing homes. How difficult is it for our seniors with, or not even our seniors, but for anybody with a mental health diagnosis to actually get placed into nursing homes? And is there a big backlog of people? Is the answer to the problem that they're starting to age at home and trying to keep them in their homes because we can't get them into nursing homes? And I mean, $163,000 doesn't sound like very much money for the entire state of Connecticut for screenings for people with mental health. I know it can take an entire day to fill out the form with somebody that has a mental health diagnosis. So just curious who these contractual people are, how it all works, and the $700,000 for an increase with the psychotropic drugs. Why is that on DMIS and not on like the Medicaid or the Medicare or what, you know, their insurance. I'm just curious about that. And I do know that now we do have people with Alzheimer's or dementia that when they go into the nursing homes, they're given some mental health, they're given some psych meds to help their behavior a little because it's, you know, a new situation, a new room, new lights, noise, and then they're not being able to get into nursing homes. So do we have a big problem on our hands with anybody with mental health diagnoses or on psych meds getting into nursing homes?
We actually, thank you for the questions. So in terms of the psychotropic drugs, as an IMD, an Institute for Mental Disease, we are responsible for paying everything associated with the care of those folks who are in our care. And so that would include psychotropic medication. So it is not for the person necessarily in the community. It's for a person that is in our hospital that may need psychotropic medication. So we're responsible for paying for that. In terms of nursing home level of care, we have a very successful program. You may have heard of 60 West. So it's a nursing home that specifically takes care of individuals that have had a history of mental health issues or may have some involvement with DOC, for example, and may be harder to place. And so there's specialized staffing and programming and sensitivity to for those individuals that is more culturally appropriate for our population, and they've been very successful in taking care of those folks. So I am not seeing that to a huge degree.
So where is 60 West?
In Rocky Hill.
Okay. But I mean, but if you're from New London and somebody, they want to put you, what happens to the people that don't want to leave their community, that don't want to leave their family members in Eastern Connecticut?
The entire state, for the time that I have been here anyway, has been focused on rebalancing. So getting individuals back into the community or diverting them from going into an institutional level of care. So there's the programs that I spoke to earlier, Money Follows the Person, the waiver, mental health waiver program. All those programs are really focused on being able to keep people aging in place. So they've been very successful.
So who are the contractors that get that money from this
Senator Marks,
section?
how many questions?
Well, that was part of my first one that you just didn't answer.
No. You senators will slide those in very well. I'm hip to that. I think the issue of nursing homes is something you're going to have with DPH and DSS, because all three of those entities, besides DEMIS, are involved in choosing and placing people. So I think in order to have a really good, robust conversation, we should maybe have a work group that looks at that together so that you get all of the agencies that are responsible, as opposed to finding out, well, I should have talked to that person or that person. So, okay, thank you. Are there any other questions? No, you've had your choice. Thank you so much. Yes, Representative Johnson, and it's a brief question, isn't it?
It certainly is. Just thank you so much. And I do have that same problem in my district with lots of people not being able to get into nursing facilities. So I thank the good chairwoman's recommendation to have a working group on this issue. Thank you so much.
Thank you. Thank you very much, Commissioner,
Thank you.
and thank you for your team for being here. Have a good day. Next, we have Department of Public Health, and I saw Adam getting everybody in here earlier. Just so all the commissioners that are here today, they're all invited to come and sit with us tonight from 2 o'clock until, because we have about 15 hours worth of testimony that we'd love to share with you. Coming forward. Yeah, you can always tune in on Zoom. That's what's so wonderful about today. You can all participate no matter where you are. I believe the commissioner's on Zoom. Yeah. I saw her for a brief moment. I saw her. I think Lisa had her in her. Oh no, there. She is. Okay.
Sorry, I'm here. If you were talking about me, I apologize.
That's no, no. Just confirming with them that you were here. They were keeping their fingers crossed that you were ready. Yes, she is. She's on Zoom. So good afternoon. No, sorry. Good morning, Commissioner. We still have a few more minutes, but 35 more minutes of morning. But it's good to see you, and thank you for your testimony. And you can go right ahead, ma'am.
Thank you very much. I want to thank you for the opportunity to virtually to you today. I am actually in the Humphrey Building of Health and Human Services in Washington, D.C. right now. I was recently elected by my peers to be the Secretary Treasurer for the Association of State and Territorial Health Officials. This is our peer organization. And I have the opportunity to advocate on behalf of Connecticut here. We'll be making Hill visits a little bit later this week, again, advocating on behalf of Connecticut, and did have the opportunity to just hear and meet with Dr. Miriam Delphin-Rittman, one of Connecticut's own. So with that, I know you have my testimony and I'm open to any questions.
First of all, congratulations, I think, for your new elected position. Whenever we get elected to new things, we get more work. So I just hope you're ready for that. Thank you. I'm going to start first with my standard questions. First of all, in your Department of Public Health, do you have any dollars that are lapsing in your budget?
Yes. So we had for fiscal year 23, $31 million in lapsed funds approximately. Most of that is from our vaccine program. For fiscal year 24, we have no projected lapses at this time.
That's great. Okay. I guess, do I want to use my question? All right. I guess the question that I would have is that we struggle with trying to figure out the right size for our vaccines. I know that one is because of the demand, and two, it's because of the continued research that goes on that improves and develops new and better ways of protecting our society. Tell me, how have you addressed that so that as we go forward, we don't have funds like $31 million going through?
Absolutely. Thank you for that question. One additional factor I would add also is population estimates on who the eligible population is to be vaccinated. And one of our challenges through the pandemic was that some of those routine numbers that were generated were delayed. And so older numbers were being used to generate these estimates. So because of that, and we have had updates to those types of population numbers, and again, keeping track, as you mentioned, of a lot of the uptake. Again, through the pandemic, many children were behind on vaccinations. So a little bit of an overestimate, and that sort of balance, we are now looking at very critically on a quarterly basis to make sure that our yearly estimate is more accurately represented and we can scale up or scale back a little bit more effectively and with more precision. So I have more confidence in what we're doing going forward so that we don't have this type of problem in the future.
Thank you, and thank you for that that information. Also, in your budget, what ARPA dollars are you still working with, and are you lapsing any, or have you utilized all of it?
So two of the major areas, I would say three major areas that we are actively working on is number one, our lead program. So as you see in my testimony, there's a certain amount of funding ARPA dollars that are dedicated to local health departments to do case investigation when there is a child who's identified as having an elevated lead level. And so there's a certain amount dedicated to that. The other part is dedicated to being actually able to do abatement activities within homes to get our homes lead free. That money is moving, and we expect it all to be administered in the time period that we have to be able to use these funds. Additionally, I would say that we have a student loan repayment program, which is going to be going live in March. And so there's about $11 million there, but that whole program is going to be able to be live so that people can apply to that as well. Additionally, the third one I want to just highlight is that we have RFPs that went out about increasing behavioral health providers in pediatricians' offices, social workers on the ground who can provide those types of services. I believe we had 27 applications for those RFPs. That is actively in process, so I envision all of that being able to be spent down as well. So we are on track to utilize all of our ARPA dollars. I'd like to turn it to Michelle Schott to just fill in any gaps on ARPA dollars, if that's of interest to you.
Yes, please. Go right ahead.
Again, I'm Michelle Schott. I'm the Chief Operating Officer for TBH. Right now, we have obligated about $30 million of our opera funds. The remaining balance is the lead. Most of it is the lead. And right now, we're paying that off of non-PO vouchers, so it doesn't get obligated. But we will be obligating it come July with purchase orders, so it's obligated and ready to be spent by the 2026 deadline.
So I'm sorry. So you have $30 million in total for your ARPA funds? Is that what-
No, we have 66 million in total. That's the 30 million for the lead program.
That's just for the lead program?
Mhm.
Okay. And of that lead program, how much of it has been obligated? None?
So that doesn't, let me just look. Do you know if anybody thinks they're obligated?
When were you,
So-
when were you?
So right now, to pay for the,
Just
oh,
one second.
okay.
When were you granted the money for the lead program? What year?
22.
So you got the funding for this in 22 and this is 24 and you haven't obligated any of the dollars out?
Well, we're not obligating the dollars as of right now because we're paying for the lead abatement through a non-PO process, which doesn't obligate the money. So coming July, we're going to actually do it through a purchase order process, which will then obligate the funds so we can have them spent by 2026.
Okay, could you bring to the working group, I'm sure my colleagues are going to want to jump on this.
Okay.
But could you bring to the working group your ARPA funds when you were granted those dollars and where they are with the balance and where you have projections on how much you're going to utilize? Okay, is that for the lead abatement, for the evaluation, for the student loan repayment, and for the behavioral health providers? There are only three, correct? Do you have, because you had some other ARPA, you had some
Yes.
for community violence programs, I believe, and some others. So probably would like to have all of them, okay?
Yep.
Just so that we can have an understanding. All right, with that, I'll open up to questions from my colleagues. I don't even have to look to the right. Representative Dillon, followed by Senator Marks, followed by Representative Gilchrist, followed by Representative McCarty, and then I'll pick up anybody else along the way. Oh, and Representative Johnson. Go right ahead.
Thank you, Madam Chair. Am I directing my question? Is the commissioner gone now?
No, I'm here.
Oh, hi. I'm looking at your testimony, or I was this morning, and I wonder if you could bring to the work group just some clarity on the gun violence, if only an organizational chart, because it looks like our titles are a little bit different, and also so we can fully understand the implications of the reallocation. So that's number one. Just more detail on gun violence and on the title and where it fits in with the overall injury prevention initiative, which has been longstanding in your department. So that's important. And I don't know if this is a nested question, Madam Chair, a list of all the reallocations and the reason for them. And that would be, so that the gun violence is a reallocation, but there are other reallocations here. And then the final question is more detail on vaccines to understand which vaccines were all of the vaccines equally not used? Obviously, we've just gone through a 2-year period where we have a breakout of polio in New York State. We had whooping cough out in Suffolk County, and people are talking about measles everywhere, which is a natural anxiety. I just want to make sure that we know what we're talking about when we look at what's happened with the vaccines, and that was a good partnership with industry. It protects their covered lives as well, and it protects us. So any further information you can provide for us about the details of what was not used in vaccines would be really helpful. Thank you.
Thank you. Senator Marks.
Thank you, Chair. Hi, Commissioner. It's good to see you.
Hi.
So the health districts, I just know, with the pandemic, we all saw how important public health is and that we probably don't fund it as well as we should, and that our health districts just did an unbelievable job keeping us all safe through the pandemic. And it just seems like even after the pandemic, we're not giving our health districts any more money than they got before the pandemic. So the 1.93 per capita and the 2.6 for larger municipalities, or if you have 3 or more municipalities, does that change yearly due to inflation, or how long has that actual rate been set the exact same? Because I do know that the health district budgets in the municipalities that I serve really hasn't changed all that much. And, I know that at least the workers hopefully are getting a COLA. So has that changed over the years, and when does it get changed?
So I'll start, which is that amount which needs to be fully funded in the budget every year has been outlined and certainly in place for a certain number of years as a pretty flat rate, to your point. That is the per capita amount that comes through our state dollars. I would also say, though, that we are getting CDC dollars and workforce development dollars, vaccine dollars. We have almost 60 contracts going to our districts and our departments so that our local health departments are actually getting a lot more from DPH that is not necessarily from per capita, but so there is additional funding going to them. I'd like to just turn it over to Michelle Schott also just to talk a little bit about your exact question on maybe how long that much amount of money has been there and any sort of increases. Michelle?
I don't think it's been pretty recently, I would say within the last 5 years. I don't know the exact date of when it was last updated, but I can get you that information.
Okay.
I think Deputy Commissioner Morrissey may have an exact answer at this time. I see that she's come on. If Lisa, if you have any additional comments?
I do. Thank you. Good morning. That actually had increased during the pandemic. There was a slight bump that went into that, but other than that, it has been pretty flat. But I just wanted to clarify that they did see an increase during the pandemic.
Okay, can you just show us then maybe for the working group how much that local health districts are how much their budgets have increased over the last maybe 4-6 years? Just so that we know that our municipalities and the public health departments are getting what they truly need.
Will do. Thank you.
Thank you.
Thank you. Next, we have Representative Gilchrist, followed by Representative McCarty, followed by Representative Johnson, and followed by Senator McCory.
Great. Thank you, Madam Chair. Good to see you, Commissioner. Hello. My question has to do with DPH's laboratory information system and the EPIC interface. It's my understanding that since about November 2022, some providers are having to send their tests. They're having to do that work now internally versus sending it to the public health lab, and that's costing those entities dollars. So just wondering if you could give a status update on when that is going to roll out? And then to bring to the work group, could you provide us with the number of providers who've been impacted by this, the provider types, and then the types of tests that have had to be done internally?
Sure. So on this particular point, we have certain tests that our state public health lab is able to provide at no cost to certain providers. And if the tests are sent to the public health lab, those tests can be run. Now, certain providers have progressed and are fully automated electronic using systems such as Epic, as you mentioned, to order tests, bill for tests, and all of that. Our laboratory information management system has been going through an upgrade, which we have used CDC dollars to do a massive overhaul on being able to get our entire system electronic. But this has been a slow and steady process. There have been certain hiccups along the way with the laboratory information management systems themselves. It's not just a DPH issue. So what we have told all our providers is we are more than happy to continue providing this service. Unfortunately, it is a paper service. So if you can submit your requests via paper, we will most certainly provide this free service to providers. Often it's around things like sexually transmitted disease testing, but it could be other things as well. And so there is a certain amount that is set by statute, but that we do provide as a service. So for those that have chosen to go to a purely EMR-based strategy and want to file electronically, right now at this moment in time, we are not prepared to do that. And I don't want to give you an exact date on when we will be ready, because unfortunately there are multiple players aside from just DPH who are involved in being able to execute on that goal that we have as well, to have a fully automated electronic billing system with providers.
Okay, great. Thank you. And thank you for being willing to bring that information to the working group. I
Yes.
think it would be helpful for us to understand kind of what those costs have been to the various provider types. Thank you. One more question. That's okay. Also, I'm being told that with regards to the school-based health centers, they had received a cost of living adjustment, but they didn't receive the entirety of that COLA. And so are there any plans to send that remaining COLA? They haven't gotten it since last year's payment.
So I am going to turn back to Chief Operating Officer Michelle Schott. Michelle, can you comment on the COLAs?
So we expect to have the COLAs out. We expect to have all COLAs out by the end of the fiscal year. We're working on the school-based health centers, and we'll have their contracts in place with the COLA by the end of March.
Thank you.
So I'm going to jump in real quick on that one. So the contracts for all of the school-based health clinics will be delivered by March, signed by March,
We're hoping to have,
implemented by March.
yeah, we're expected to have them all executed by the end of March.
Okay, what does executed mean?
Signed. So everybody signed it, the Attorney General's office,
Okay,
our
so
office there.
As Appropriations Committee, we want to know, when do they get paid?
We're going to get all the COLAs out by the end of the fiscal year.
Okay, when did you receive the money to do the COLAs?
Some of them this year and last year.
So it's been 2 years?
Mhm.
So can you imagine running a business with not getting paid for 2 years?
Yes, ma'am.
So
Absolutely.
the importance of them getting their funding like everybody else
Mm-hmm.
on a timely manner so that they can operate is really critical, okay?
Yes, we
So
are
we'd
aware.
love an update on that as soon as possible. Thank you. Representative McCarty.
Thank you, Madam Chair. And my question is directed to the Commissioner. If she would, please. I notice in the budget adjustments that there will be a new nursing home dashboard. And if she would comment on that. And then I noticed also that the goal is perhaps to have a center, a model of excellence for nursing homes, and that incentives may be provided to the nursing homes for that. If she could just comment on that, and then congratulations on your new appointment.
Thank you so much. Appreciate that. And thank you for this question. So the first, as you were mentioning, is a goal to, in the governor's budget, have $500,000 in ARPA funds that can specifically support the development of a public-facing nursing home consumer dashboard. The goal of this dashboard is to provide quality metrics that consumers can evaluate the care that is being provided in nursing homes beyond just star ratings that Medicare provides to consumers. So this would satisfy our goal within DPH, which has been to be able to have a quality assurance mechanism and dashboard to be able to monitor quality among nursing homes. But this takes it a step further, which makes it a consumer-facing dashboard so that consumers can actually evaluate that. The second is $250,000 in ARPA funds. And this is really just to conduct a study on best practices in nursing home care and design a plan for centers of excellence. So really, this is all about a study and a plan to promote such a program in Connecticut. It's developing the model for this type of care. Implementation would be thereafter, but this is really developing the plan of what centers for excellence can look like and how they could be implemented going forward.
Thank you very much for those.
Turn on your mic. I didn't do it.
Thank you very much, Commissioner. And I really do think it's a wonderful proposal. I would just ask if maybe some thought could be given. You know, we need to have long-term care facilities as we are moving to balance and go to home and community-based, but we want to assure that our nursing home facilities are the best they can be. And I always appreciate the approach for incentivizing and incentives. So perhaps as we go forward, bring some ideas to the working group, how that funding might be put in place. These are, I believe, through ARPA dollars right now. And so these are one-time costs, but if we're going to have a model like this, perhaps some thought on how that can be sustained going forward. Thank you very much.
Thank you, ma'am. Thank you. And I agree with you. It's ARPA funding, but if we want to keep it going, we've got to figure out how to build it into the base. So thank you very much. Representative Johnson, then Senator McCory.
Thank you so much, Madam Chair. And just following up on the skilled nursing facility issue and the ARPA dollars, are we in a situation now where we're looking at the HVAC systems in our skilled nursing facilities, and where are we in terms of the renovation of the HVAC systems so that they don't transmit disease?
Is your question specifically, I just want to clarify, around HVAC systems in specific nursing homes?
It's in nursing homes that I presume you've been in the nursing homes and looked at the systems, or are you just receiving requests for assistance with upgrading the HVAC systems? What's your system for that, I guess? Thank you.
Yeah, so the way that nursing homes can renovate their HVAC systems is they can apply to DSS to receive funding for specific upgrades that they're looking for within their nursing homes. For us, we don't really have much oversight over HVAC specifically. Ours is more focused in terms of CMS guidelines and state guidelines on specific patient healthcare quality and safety metrics. So the main way that homes can do this is really apply to DSS for funding to be able to make those upgrades.
Thank you so much. Thank you, Madam Chair.
Thank you. Senator McCory, followed
Good
by
morning.
Representative Porter.
Good morning. Good morning, Commissioner.
Morning.
Couple quick questions. I'm sure you're familiar with the Data Havens Report on Health Equity in Connecticut 2023. It speaks to a number of issues around inequity you have in the state of Connecticut, not limited to infant mortality rates, life expectancy rates, guidelines. What specific, I want to make this question a financial one because it's appropriate. What resources do you have specifically in your budget to address these inequity outcomes in the state of Connecticut?
Yes, thank you. So a lot of our focus, first of all, is that we have set up an Office of Health Equity and recruited a new chair who I presented to many of you at the Black and Puerto Rican Caucus. For maternal and infant mortality in the budget, we specifically got a position to be able to support infant mortality. And we are setting up an infant mortality review committee to be able to supplement our maternal mortality review committee. So that is one specific item in the budget as it exists. Outside of the budget, as we've discussed before, we're an agency that is 80% federally funded. And so we have lots of funding streams through the CDC, through HRSA, through other federal mechanisms to address many of those pointed issues on heart health, diabetes, maternal mortality, a lot of the chronic diseases where we know there are discrete inequities within our state. And so we do continue to leverage those funds to address those issues.
So you're saying we have a lot of federal funds to address these issues. So can you bring that data? Where are we getting these federal dollars? How much and what programs are they going to be used for? But I'm more interested in what are we doing from the state level. So can you bring that data? Because I'm looking at your testimony and it says one of the things you want to do is strengthen initiatives in your health equity agency. The Office of Health Equity will be looking to promote more collaborative relations centered on health equity within the department with external partners. Can you talk to me? These partners, are you going to be working to address all these major issues in health equity in Connecticut to our working groups? I want to know what dollar amounts we're going to be using and what programs we're going to use to address the health inequity that we have in the state of Connecticut. I'm reading their report and it scares me when I look to their summary, and I'm sure you've read this and your people in office read this. It says that nearly all the health, all the health barriers, risk, and outcomes in these reports are preventable. All these 15,000, you saw the data just like I saw it. We lost over 14,000 people over the last 4 years for reasons that could have been preventable. And I would like to know, when we hit in our working group, what resources and what programming you plan to do to make this situation go away? Because if it could be preventable, that's a number of lives that we could have saved over the last 4 years. So I would like to know the financial dollars and what programming we're going to do to address these issues. I thank you very much and look to working for you in this working group.
Thank you. Will do.
Thank you. Representative Porter.
Thank you, Madam Chair, and good morning, Commissioner and team. Great to see you all and you virtually. Question for you, kind of to piggyback off of the health equity question that was asked by Senator McCrory. I'm very interested in knowing where we are with the Black maternal bill that we passed last year. And if you could bring that to the working group and just touch on it briefly for us, for those that won't be a part of that, where we are currently to date with the implementation of that and what's left to be done.
Yes, thank you. So, that was a pretty wide-ranging bill that was passed. And part of that was the infant mortality approach that we are taking. In addition to that, I would say that we have come forward with our birth center plans where we are working with stakeholders, and those specific policies, procedures, and regulations that will come are going through the process to be able to make that a reality in the state of Connecticut. Now, one of the things we're going to have to do is try to see, with all of your help, if people will be willing to come into the state and serve that role and serve the role of birth centers within the state of Connecticut. So we are close to having that regulatory scheme in place to be able to make that a reality. And we look forward to seeing if partners are willing to come into Connecticut to serve that very important role and place in our communities.
Okay, that's really interesting because I actually have people in community that have been doing this work for a very long time that would be very interested in standing up a birthing center. My district in particular. So I would love to have further conversations, discussions with you around that, because you're saying that you're looking at people to come into the state. to provide these services when we have people already in the state that I believe are more than qualified and very anxious to provide those services. And because of the disproportionate impact, you know, and I'll speak for New Haven, you know, in New Haven, Black women are 7 to 8 times more likely to die in comparison to their white counterparts. Our babies, the infant mortality is 4 to 5 times. And I'm gonna even assume that it's higher than that post-COVID because I'm hearing that the numbers are actually going up, Commissioner. So I would really be interested in making sure that we're using resources and lived experience from people that have been doing the work and continue to do the work. And we know how important it is to have cultural humility. I know we talk a lot about competence, but I think the humility part is much more significant in helping to address what we're dealing with the Black maternal and infant mortality rates. The other thing that I'll say really quickly is I'm excited that we do have the infant mortality that you're standing up, but we know if we don't have healthy moms, we can forget about healthy babies, right? So I think it really starts with the moms. Can you speak to where we are with that piece of it?
Absolutely. And just to clarify, I did not mean to insinuate that I'm only looking for people from outside the state. Most certainly, people who are already in the state, once we release the regulatory scheme that is necessary for a birth center to be opened, we would most certainly welcome, especially as you mentioned, communities like New Haven to be able to stand up freestanding birth centers. So I look forward to that engagement and we look forward to being able to share them with you. On your point on maternal health and maternal mortality, as you know, we have a block grant, we have federal funding to be able to ensure maternal health. Examples would also be something like congenital syphilis. So when moms are out of care and not engaged in care the way they need to be during pregnancy, this is where you can unfortunately have cases of children being born with syphilis. For the last 3 years, we've had somewhat of a steady number of cases, but we need to see this go down. And the way to do that is to make sure that we're engaging our moms and making sure they're connected to care. So we have been listening and putting forward the recommendations of the Maternal Mortality Review Committee, working with stakeholders to ensure that those recommendations are internalized and actually implemented and executed on so that we can continue to improve the issues with maternal mortality that we have in our state.
Thank you so much. And you know, I'm ever so grateful to what you've done insofar as making sure that we're getting this right. And the doulas, that's the last thing I'll make a plug on. I know we have something in that bill regarding doula in review. So I want to make sure that the doulas are at the table. I always say to people closest to the problems, closest to the solutions. And last but not least, Madam Chair, you mentioned, Commissioner, the new nursing home dashboard Centers for Excellence and what it should look like, the study. So I just wanted to ask, in this study, because I have several family members and friends that actually work in nursing homes, are they, how are you incorporating their feedback and their lived experience into this study that you're going to be conducting?
Yes, thank you. So one of the goals of the study in terms of the Centers of Excellence is to identify what those different parameters are that would make for a center of excellence. And so we most certainly will be looking to engage with best ideas, practices, and partners to be able to come with ideas to the table on what a center of excellence would look like. So right now, it's all about getting the funding to be able to come up with that idea and plan, but we will most certainly be open to many ideas in terms of how we will do that. And just to let you know, collaboration with stakeholders is specifically listed in the bill, as you'll see it, in terms of being able to show that we are making a best effort to bring the best ideas to the table from stakeholders.
All right. Thank you so much for that. Look forward to the forthcoming information for the work group. And thank you, Madam Chair.
Thank you. Representative Gilchrist.
Thank you, Madam Chair. To continue on this conversation of health equity and maternal health, one of the strategies that's been identified are community health workers. And I do understand that that work is still being rolled out through the Medicaid piece, but in the governor's budget proposal, it does speak to eliminating funding for the Connecticut Public Health Association. $100,000 that was supposed to go to the Community Health Worker Association of Connecticut. Can you tell me what was the intent of that $100,000 and why that funding didn't get to where it was supposed to go?
So my understanding from this group is that they did not want that funding anymore, and it was difficult to engage in this process. And so that's why that funding is being redirected.
Thank you. And what was the intent of the funding?
So my understanding of the intent of this funding was to be able to help this group stand up a little bit more independently versus in the model that they were already in initially.
Okay, thank you.
Thank you, Representative McCarty. Boy, there are a lot of people coming back for the
Thank-
8th time.
Thank
No,
you,
no,
ma'am.
not you're the
No,
second. Go ahead.
Thank you. I just have a very quick, and I know the question was asked previously about the reallocation of funds, and one of them reallocates the funds for the lung detection, early detection and referrals. Would it be possible, I know it includes a position, but could we just have a breakout how the remaining funds will be used? Perhaps at the working, I think it's a very important initiative as we've seen such an increase in lung cancer, particularly in our elderly patients. So I'm appreciative of it, but just wondered how those dollars will be allocated.
We will bring that to the next meeting.
Thank you very much.
Thank you, Representative Dillon, and then Representative Johnson, and that's it.
Thank you. Commissioner, on the issue of maternal and child health, the WIC program and the WIC voucher program, which are, the WIC voucher program is to farmers markets, is in the Department of Agriculture. And it was originally intended to be a maternal and child health program, but of course we work with the farmers market. So my concern is over the past couple of years, the drawdown of the senior component of the food vouchers has been very successful, but the program for the food vouchers for produce for women who are on WIC has not been drawn down as much. Does your department have a relationship or a working agreement with the Department of Agriculture on improving nutrition for the baseline health of childbearing women?
We definitely have a collaborative relationship with the Department of Agriculture, and WIC funding in general. Part of what I'm doing here in DC is to advocate for WIC funding and to make sure it actually comes through. And that's part of what I'm doing. But I'm happy to bring additional information to our next meeting.
Thank you.
Thank you very much.
Representative Johnson?
Thank you, Madam Chair. And just to follow up on the maternity and birthing centers, I'm hoping that you'll be including the fact that they have to be close to an intensive care unit where they're located, and having that part of some of the requirements for these centers. And also, if you could provide to the working group the information regarding the impact of large minority populations where they're in more rural areas like in Eastern Connecticut, and the impact of limitation of healthcare access in those areas. So those are the kinds of things that I know you're developing, and look forward to seeing what you have for information. Thank you, Madam Chair.
Thank you, and thank you, Commissioner. See, now, you thought you had free time for your new position down there? Nah, we got lots of stuff up here for you. No problem, and I hope.
Working for Connecticut.
Yeah, I hope OFA got all those follow-ups because there are a lot of follow-ups. It was every time another question came, another follow-up came. So thank you, everybody. Thank you for the time. And just to remind everybody, we will be back here at 2:00 and that we have 13 hours of testimony that we are here to hear from the public. And anybody who has any questions, they can talk to the people after they made their public statement. So thank you, everybody. Have a great afternoon and see you at 2 for all. Thank you.
Thank you.